There at your office, what sort of minimally invasive procedures do you offer patients?
So for me, because I do both medical and cosmetic, I have a tremendous number of things that I can do in the office. To your question earlier about functional septorhinoplasty, we can actually do many of those things in the office, and that's why I spent the time and effort with a new office to further facilitate some of those procedures. For instance, a person that has difficulty breathing and perhaps they already had a rhinoplasty, but they don't really want to change the outward appearance, there's a procedure called Latera that basically adds extra structural support to the side of the nose. There's some people, when they breathe in, the cartilage is weak. You can be born with weakened cartilage, or it can be weakened because of prior surgery. When it's weakened, you can do procedures or surgeries, borrowing cartilage from other parts of the body, such as the ear, to strengthen it. But now there are options such as Latera in the office, which is basically a fortified suture that has long-lasting results that keeps the nose from collapsing so they can keep the appearance that they want, but still be allowed to breathe. There's also a procedure called Vivere, which shrinks the tissue on the inside of the nose, and it almost acts as a cantilever on the inside to bolster the nasal airway so that you get more airflow. And all of these things can be done in anywhere from 10 to 15 minutes under local anesthetic. And the technology has evolved to the point where I find myself doing more and more in the office as opposed to going to the OR. There's always a time and place for surgery, and that will never, I don't think will ever be replaced. But at least with the technology, we're allowed to do many of those things in the office now.
Thank you, Dr. Young.